Welcome to Security Heroes, a podcast by Athena Security. We share real-life stories to help connect you to real heroes in the security world. I am your host, Lisa Falzone. Warning, the following recording contains potentially disturbing content. Listener discretion advised. Joining us today is Drew Neckar, the Principal Consultant for Healthcare Security at CoSecure. Drew is a certified protection professional with over 2 decades of security management experience, ranging from managing physical security for nightclubs to designing and operating security systems at the Mayo Clinic. In 2014, he founded the Security Advisors Consulting Group, where he drew on that expertise to become a security consultant. And after a decade of operation, his security advice was so great, his company got acquired by CoSecure, where he continues to share his security wisdom. Drew, thank you for joining us and sharing some of that wisdom today.
Thanks, Lisa. I appreciate you asking me to come on, and I'm glad we were able to connect.
Yeah, really excited to talk to you. So how has healthcare security changed in the past decade?
There's a myriad of ways, but I would say probably the largest that I've seen. I first got involved in healthcare security in 2003. So I've been involved in healthcare security for almost 20 years, well, over 20 years, which makes me feel really old, but I'm really not that old. But since I started, I think healthcare security has been looked at for decades prior to now as just a necessarily evil. And one of the things you have to have in a hospital, a lot of the time it reported into the facilities department because none of the organizations knew exactly where to put it. So it was really looked at as gates, guards, and in healthcare, not even guns, but it was really looked at as, okay, we have security guards who walk around and do something, and we put locks on doors. I think over the last decade or a little bit longer, the industry has really gone through some growth and is really looking at and being looked at by organizations as a business enabler. And how do we utilize our security function tied in with violence prevention function to make our healthcare organization work better and allow our staff to do their jobs caring for patients? And how does that happen? And I think what I've seen, at least from a consulting standpoint over the last 10 years, is a shift in the reporting structure of the security departments for healthcare. It's really been moved from one of those things that nobody knows where to put it. Maybe it'll go in facilities, maybe it goes in human resources, maybe it goes in operations, maybe it reports to janitorial. But more recently, I'm seeing, especially in the more developed programs and the larger organizations, a move toward security being part of an overall enterprise risk management strategy. Because overall, that is what a security program is. It's identifying the security risks that the organization faces, and then putting appropriate measures in place to mitigate against those risks and to control them, or at least reduce the risk. Other things have changed over the last decade too. Technology has made leaps and bounds and things like that, but all of those are just tools to accomplish the true mission of security, which is protecting the organization and its people.
Right. Yeah, I mean, a lot of people, what are your thoughts on COVID, how that changed healthcare security? A lot of people talk about that as, the post-COVID world and the pre-COVID world, kind of like pre-9/11, post-9/11. What are your thoughts on that?
Yeah, no, absolutely. That is something I see. I mean, from a base level, one of the things I've seen is I have not worked with a single organization post-COVID that hasn't seen at least a doubling in violence against staff. Workplace violence has always been a concern in healthcare security. I mean, I know in the US, it is, according to OSHA, the most dangerous industry there is from a percentage of employees assaulted at work standpoint. But during COVID and post-COVID, that increased exponentially. It's typically, most of the organizations I work with, it's about doubled. And that's not unique to the US. I've talked to people in Canada, in the UK, in Australia, who are seeing the same things, although all those locations already had workplace violence issues in healthcare. But what we are seeing is that even some of the geographical locations that did not recognize a violence issue pre-COVID are now starting to see it. I know I worked with a hospital in Saudi Arabia just post-COVID that they had not experienced violence against their staff prior to that. And they were beginning to see patients physically assaulting and verbally assaulting their staff.
Mm-hmm.
Similar to, there was a hospital I talked to in one of the Asian countries that they had not seen these issues prior to COVID, and they were starting to see it. So it is, violence in healthcare is a global issue. And I think from a security perspective, if we as security professionals aren't looking at how we can reduce that and allow our employees to do their jobs without the fear of violence, or at least not with overwhelming fears of violence, we're not doing what we need to do.
Yeah. And why do you think that is? Why do you think there's such a distinction between, post-COVID, pre-COVID? Like, is just general society just less happy, or what are your thoughts on that?
Frankly, I'm not 100% certain. I think we have seen an increase in kind of incivility and violence
Right.
and crime overall across society,
Right.
but I don't know if there's something else driving it beyond that or not. I know, at least in the US, at the beginning of COVID, healthcare heroes, et cetera, everybody was excited for our healthcare workers, but yet
Right.
we're still seeing increases in violence.
Yeah. And it's really interesting because a lot of people blame the US and the policies and all that. But it's interesting with your international experience that it's really happening worldwide.
It is. And I know I've talked to hospitals, and frankly, I see this more in my K through 12 school practice than I have in healthcare. But Latin America has experienced a uptick in violence in schools that they hadn't seen prior to COVID as well. And I don't know if it's the social isolation,
Right.
what all plays into that. I'm not a psychologist. I
Right.
may
Right.
dabble and diagnose things, but I am not. That's for people smarter than me to figure out, but it is
Right.
something we are seeing globally.
Right. Right. Can you talk a little? I mean, you mentioned Saudi Arabia and you did work for them. I'm assuming, what are gun laws in Saudi Arabia? I don't even know.
In Saudi Arabia, nobody has guns. But
Right.
well, I don't want to say that, but we don't have any of the issues with shootings that we may have in the US or Latin America or some other locations globally. It was a non-issue there. It was physical violence,
Hmm.
and frankly at a significantly lower level than we would see in the US as well. For them, a major incident would be, hey, a patient slapped a nurse
Right.
versus beat somebody almost to death or a shooting.
Are knives an issue there?
Not in my experience, but frankly, that's somewhat limited. The one organization I
Yeah.
worked with over there was a large university campus that was 22 square miles, that had a hospital on it, was basically a self-contained city. And they had gates where everyone coming through the gate was screened. They knew the identity of everyone who was on that campus at any time. So it was a very different environment than we would typically see in a hospital in the center of New York City, or even in a small town in rural America.
Right. So last year you did a huge study of visitor management and weapon detection systems for hospitals. And while I was glad to see Athena had the highest user satisfaction scores, I was wondering if you could talk more generally about how hospitals should think about visitor management.
No, absolutely, absolutely, and I think that one of the things that segues really well, because one of the things I wanted to mention post COVID is
Hmm.
that for decades prior to the pandemic, healthcare security directors and security leaders were telling our organizations, we need to control and understand who is on our campus.
Right.
Frankly, at least in my personal experience, and from what I'd seen across numerous organizations, the majority of the time that was met with, that's impossible. There's no way we can screen every person who's coming into this campus. it just is a physical impossibility. It'll impact our operations too much.
Right.
COVID did us a favor. It demonstrated that, no, we can absolutely do this. And I think post-COVID, we are starting to see the benefits of that, and that hospitals are recognizing that, yes, in many cases, it is possible to set up, whether it's visitor management systems, weapons screening, all of these things to a little bit better control who is on the campus, or at least specific areas of the campus. And I think from that study that I conducted, what I saw, and that was predicated, I was doing work for an organization. They were looking at revamping their visitor controls and their weapons detection. And they asked, what is everyone else doing? So we did benchmarking. And I think we talked to about 50 different healthcare organizations for that. And what I was really surprised at was how many were moving toward visitor management. It definitely wasn't all of them at this point. And I don't remember the exact numbers off the top of my head, but there were a significant number. I would say it was close to 50% that either already had or were looking at implementing some system to control and understand who was on their campus at any time. We've seen that in some types of healthcare for years. It's really been almost a de facto standard that children's hospitals at least manage who is coming in and screen people and understand who's on their campuses. But general acute care hospitals, we haven't seen that. And I think we're moving toward that. And that's similar with weapons detection. That study also looked at that. I was actually really surprised with that. While approximately 50% of the hospitals we talked to already had implemented weapons detection technology of some sort to control either access into their facility as a whole, or more often access into specific areas like their emergency department. That's where we see most often weapons detection deployed. But if 50% had already deployed, almost every one of the hospitals that had not was in the process of considering implementing weapons detection somewhere within their facility, which 10 years ago, 15 years ago, would not have even come up in discussion in a lot of places, except those hospitals in some rough inner city neighborhoods that are typically dealing with gunshots, gun victims on a daily basis.
Can you talk a little bit more about like visitor management, and from like the security, like the director of security's point of view, why it's so helpful for them to know who's in the building? And one thing with the visitor management is I'm just always surprised that there's no like check out procedures typically. So it's like, how do you know if they haven't checked out yet? So anyway, if you could just talk a little bit about that, that'd be great.
No, absolutely, absolutely. And I think you're absolutely right that I don't know that I have seen any healthcare organization with an effective visitor management checkout procedure. I
Right.
don't think we have. And frankly, I was somewhat surprised going from healthcare. I left healthcare for a little bit and went to a company that was in corporate America. And our corporate offices, we had visitor controls and very strict visitor management. And we did. We had policies and procedures to ensure that everyone who had checked in also checked out. And if somebody wasn't checking out, our security staff was following up on that and identifying, hey, did they slip out somehow, forget to check out? Are they still somewhere in our building, etc. But I don't see that in healthcare. But the benefit comes from being just even giving that vision to the public walking in of, all right, we are aware who is here. If you're here, we know who you are. I think that is a huge assistance in decreasing some of the common street crime stuff we've seen over the years. I know most of the healthcare organizations I've worked with, again, once they implemented visitor controls during COVID, their rates of just basic theft, things like that, plummeted because all of a sudden we don't have extraneous people who are just able to wander into the facility. And there are a lot of people who have targeted healthcare over the years for just basic theft. I know there was one organization I was working with that has hospitals across a number of states in the Midwest where they have a centralized investigations department for thefts and for a number of other incidents. But while I was consulting with them, one of their investigators had been assigned to investigate just basic purse or wallet thefts at 3 different hospitals, was part of his caseload. And as he was reviewing video, he noticed that the same person was going into each of these 3 hospitals, which were 2 hours, 3-hour drive apart from each other, and was the suspect in these thefts. That led to going down a little bit deeper rabbit hole and realizing that this person, who actually had previously been a healthcare security officer in Florida, was on about a month and a half tour of the US. He had started in Florida, driven over through Mississippi and Georgia and Louisiana and Texas, and then up through the Great Plains states and come back through the Midwest, and was hitting 5 or 6 hospitals a day, just parking his car, walking in a shirt and tie like he owned the place, and rifling through desks and stealing credit cards and cash and everything else. And then done. He actually ended up getting arrested. He was on his way back south and was arrested in Kentucky, but I think he had a couple of hundred different thefts from hospitals that they were able to pin on him. And that was pre-COVID, when you could just walk in.
How do you recommend a hospital setting up like a checkout procedure?
I think it's difficult. I really do. I think the emergency management benefits of it, of knowing who is in the facility at any one time, would be huge. Unfortunately, what I see is most hospitals weren't designed for check-in and check-out. They really weren't. So trying to make that work within the space becomes really difficult. And frankly, a lot of hospitals struggle even with check-in. That's one thing. I worked with a large healthcare organization recently, trying to help them redesign their lobbies to allow for that and make it effective, because they were trying very hard to check in every person who came in the front door and scan their ID and just verify who they were and verify that they were going somewhere legitimately within the hospital. But with the design of their lobbies, there were people getting around that, moving around that. They tried to do things by moving around planters, by putting up stanchions, but it just wasn't being effective. And frankly, from a risk perspective, and this is purely my opinion, and stating it'll probably come back to bite me at some point, but I think that an organization subjects themselves to more risk and more liability if they say, let's do visitor management, but don't do it effectively. Don't either enable their staff to be able to do it, don't design their space effectively, than if they hadn't done it at all. Because they're saying, yes, we've recognized this as a risk, we do it, but we didn't do what we had to do to make sure it worked. So I think organizations first need to get to that point where they're doing visitor management effectively on the check-in before they can even move to that second step of checkout, which I think would give huge benefits on a number of fronts.
What's the most dangerous security situation you've seen in the healthcare world?
Most dangerous.
Yeah, and did someone have to step up to play the hero in order to handle it?
Yeah, absolutely. There's one from actually my fairly early days in healthcare that I've spoken about a number of times at a number of different conferences, because there's a number of lessons I think can be learned from it. The hospital I worked at the time, I was not in a senior leadership role yet. I was a night shift supervisor at this hospital, mid-sized hospital in Wisconsin, about 300-bed hospital, about 2 million square feet. We came within minutes of having an active shooter incident in the hospital. And the reason we didn't, well, there was multiple reasons, but in the end, it was because 2 of our security officers were able to confront the person. And when he went to draw the firearm, they were unarmed, but they were still able to take him down and take him to the ground and disarm him. And that's, I mean, I was actually working that day. It was 7 o'clock in the morning on a Saturday morning, and I had been working the night shift and somebody called in sick. So I was sitting in our office / control center and trying to make calls to try to get somebody to come in so I could go home. And the first thing that went right is we had trained our staff throughout the facility to recognize when something didn't look right. What is suspicious is the way I like to put it. Because if you're in a room full of people, you ask them, hey, what do you do when you see something suspicious? Everybody will raise their hand and say, we call security. But if you take that to the next step and say, well, what is suspicious? Typically, you get blank looks. And what we always train people was something suspicious is something that doesn't fit that location and what people's normal behavior is. We actually, in this case, we had a dietary employee in our cafeteria who came into the security office and said, "Hey, it's probably nothing, but there's a guy came into the cafeteria. He's in a long black trench coat. He's just standing in the back. And when I went up to help him and ask him if he needed help, like you taught us to, he said, no, I'm fine," and rushed out. That just didn't seem right. And so it's like,
Right.
okay, we got a suspicious person. There were at the time in that hospital, I was sitting in the dispatch office. I was the supervisor. We had 2 security officers working to cover that. Luckily, we were able to identify where he went first because we had security technology deployed. We
Right.
had, okay, these are our public corridors. These are what people can access. And then cameras at choke points to be able to identify, all right, here we can follow where he went and fairly quickly narrow down to, okay, this guy's on this floor, etc., and get the 2 security officers up there to confront him. But that was one of the scariest moments of my life, was as our security officers radioed in that, hey, we've located him, he's on the 6th floor. And I was talking to police dispatch with the phone in my other ear because it's like, it's suspicious, but maybe we'll get somebody started this way just to see what's going on, just in case
Right.
it's something bad. And our security officer screamed out, "He's got a gun, he's got a gun," over the radio. And then it went silent because, of course, they were in the process of tussling with him, disarming him, getting him in handcuffs.
Right.
But it probably lasted 15 seconds, but it felt like 30 minutes as the police
Yeah.
dispatcher screaming in my other ear, "Get him on the radio, is everything okay?" Like, I don't know, because it wasn't an area where we had cameras. They were able to take him into custody. And I mean, to make a long story short, he was fairly intent. He was schizophrenic, off his medication, was carrying a 44 Magnum revolver and 200 rounds of ammunition, and
Wow.
was fairly intent, I believe, and the police believed, on shooting and killing people in our hospital.
Wow.
And it was only through the actions, first, of that dietary employee to be willing to come forward and bring that to us. And
Right.
second, 2 security officers to step up and manage this threat, even though he was armed and they were unarmed, which I would
Right.
never recommend. But they were in the spot and they did what they had to do. And that's not the only time I've seen healthcare security officers who were unarmed deal with deadly threats. There was another organization I was working with as a consultant that, while I was working as a consultant there, they had a domestic dispute boil over in their cafeteria. And one of the terminated contractors, who'd been terminated for domestic issues with his wife, live in, I'm not sure their exact relationship, ex-partner who worked in their cafeteria. He'd been
Mhm.
terminated by the contractor, but he came back in the middle of morning rush in the cafeteria, walked in, pulled a knife, and started stabbing her.
Ooh.
And there happened to be a security officer from this organization who was getting his breakfast at the time, who jumped in and was able to disarm this guy before he stabbed anyone else or was able to finish what he was trying to do to the other employee. So there's been a number of times, and those are
Employee-
just the first 2 that jumped to my head.
That's crazy. Was the employee okay, or
Uh, she was injured. She lived, but
okay?
she was pretty significantly injured. I believe she was stabbed half a dozen times before anything happened.
Yeah, one thing I didn't realize is that the primary cause of violence in hospitals is coming from domestic partners.
Yeah,
I didn't.
and I don't know if it's the primary cause of violence, but it is the primary cause of extreme violence. So
Right.
stabbings, shootings, etc. I think probably more common is the patient on nurse, patient on caregiver, pinch, slap, etc. But I know I've actually done some research recently, well, actually over the last several years, on shootings in healthcare. And I've actually got the file here. Let me take a look. I think it's around 30% of those are, yeah, between typical domestic violence, which is what we would typically think of as domestic, and then also what I would also consider domestic, those mercy killings where a husband or wife kills their significant other who's terminally ill, Between those two, that accounts for 30% of the shootings in the healthcare environment between 2009 and 2023, at least that I've been able to locate. So that's looking at a data set of about 350 incidents over that time. And that's 30% of the shootings.
Right. You recently wrote an article about how healthcare organizations can improve security while lowering costs. Any tips for our listeners?
Yeah, I think the biggest thing is looking at kind of what we talked about at the beginning. Why do we have security? What are we trying to accomplish? And I think because organizations over the years have put things in place just to put things in place.
Mm-hmm.
And if we look at that and look at everything that we do as a security department for a healthcare organization and say, why are we doing this? What are we accomplishing by doing this? That can lead us to really identifying, is there a better way to do it? I think I called out in that example, or maybe that was a different article I wrote, but because it wasn't healthcare related, it was a career college campus that I worked with that had security officers and contracted them to stand at each one of the entrances because they were in a high crime area. They had issues with people coming in off the street. So they had, I believe it was 8 security officers working at a time. All the times this campus was open, we looked at that and said, how many of those doors are actually used by people who aren't a student, aren't faculty, aren't somebody that you see on a daily basis? And it came down to one of those entrances is. And so what we did was, all right, let's make the capital investment for a electronic access control system and provide everybody who is here on a regular basis, the staff, the students, et cetera, an access card. So we don't have to have somebody at that door anymore. So we were able to reduce staff from 8 to 1 and huge operational savings over time that I think paid off the capital investment in under a year.
That's awesome.
Yeah.
Yeah, I was going to ask about college campuses and with all the protests that are happening, what should school administrators be doing from an enterprise security risk management standpoint?
That's difficult. That's really difficult. Anytime we have those type of kind of politically charged activities, it is a real challenge to be able to respond both with empathy to both sides of whatever the question is, but yet ensure that the safety and the operations of the organization aren't unduly impacted. And primarily the safety, because the operations, anytime we have those protests, operations are going to be impacted somewhat. But how do we make sure that that environment is safe for everybody who needs to be in the environment? And those university campuses, I do some work with large universities. The rest of my firm does a significant amount of work with some of the larger universities in the US. So there are other people who can speak to that better than I can, but my history is in healthcare and then smaller kind of community college campuses. But it is a real challenge. And I think just responding with empathy, but yet understanding how we need to do that to keep the people on the campus safe. That's what we need to aim for.
Yeah, definitely. Well, this has been really great, really informative. So just in closing, any final advice for organizations looking to lower their risk of security related litigation?
Oh, I think the biggest thing, and that is part of my practice, I serve as an expert witness, both on the defendant side when somebody sues a hospital and occasionally on the plaintiff side when an organization has really been negligent. But I think the biggest thing organizations can do to reduce that liability is do what you say you're doing. That's where I see the biggest gaps is when an organization has policies in place, has procedures in place, has processes in place, kind of like we talked about earlier with visitor management, where they've recognized a risk and said, hey, this is an issue. We've done this to counter it, but then don't do that effectively or stop doing that. And to say, well, we stopped doing that because cost, et cetera.
Right.
Instead of we stopped doing that because now we're doing this instead, and that mitigates the risk to the same level or better. So once you've started doing something, be very cautious pulling that back and be able to explicitly state why you're pulling that back. Does that risk no longer exist? Or are you handling it some other way?
Right. Sorry, just one more question. What's
Yeah.
the one thing you would like all healthcare organizations to learn?
Oh, that's a big one. And I think the biggest thing we talked about earlier is that how does security fit into the business model? And
Hmm.
what why do we have a security department? Why do organizations have a security function? What are we trying to accomplish? Because I still see in probably 30 to 40% of the organizations I work with, they haven't answered that question for themselves.
Hmm.
They have security because Joint Commission or DMV says they should have security. CMS says, yes, we need to do something about violence. So, but truly understand what that means to the business and what security brings to the business,
Right.
how that works and enables the business to do its work.
Awesome. Well, thank you so, so much. Really enjoyed this. And I think it'll be really informative to our listeners.
Thanks, Lisa. I really appreciate you having me on. It was great to connect.
Yeah, you were awesome. All right. Talk soon. We'll be in touch.
All right. Sounds good.
All right. Bye.
Bye.
Security Heroes is brought to you by Athena Security. To find out more about Athena Security and how we help save lives through our weapon detection solution, visit www.athena-security.com. And then make sure to search for Security Heroes in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at Athena, thanks for listening.